Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Letzam. Hello, for today's 411, we're outside and we're out here with our EPI manager, Nurse Marina Bedu, here to talk about Vaccination Week 2019. Welcome to the program, Nurse Bedu.
Thank you very much, Natasha. It's a pleasure.
Always a pleasure interviewing you. Tell us a little bit about Vaccination Week and its theme.
Vaccination Week really started in 2002. It came about as a result of a measles outbreak in the Americas. And following that outbreak, the ministers of health in the Andean region came together. They made a proposal where they were asking that persons coordinate in the international through the international borders to put an end to that outbreak and to prevent further outbreaks in the future. So since then, countries have been celebrating Vaccination Week, whereby you're able to get to populations that are most vulnerable. When I say that, I mean that persons who have not been vaccinated or access to vaccination has been difficult, they have the opportunity now to get vaccinated through the vaccination activities that will be planned.
Why is this continued promotion of Vaccination Week so important?
The theme for this year's vaccination is protect your community, do your part, get vax. It is very important for me in Vaccination Week because at that time you get to do more education, you do more promotion, you encourage more people, you are able to reach more people who have not been coming to you, or for some reason or the other, they are unable to get to you. So you are able to plan activities whereby you would be able to reach these persons and give access to them for vaccination.
And despite the continued efforts, we are seeing more and more persons becoming a little bit more reluctant about vaccinating their children. Speak a bit about the impact those decisions are having now, and what are some suggestions moving forward to help to allay some of those concerns?
Recently, we have been having persons refusing to have their children vaccinated, and this is not only in the British Virgin Islands, but it is international. Persons have more access to the internet, and so they access information from those websites. They don't know what to take, what to believe in, and so the most negative ones would really attract them, and therefore they use that against the vaccines that are so important and so effective to refuse vaccines for their children. We are trying to educate those persons and let them know the importance of vaccines throughout the region. Vaccines have saved lives. Vaccines have protected persons, prevented diseases that can be prevented through vaccination through the years. For example, polio. We have smallpox. We no longer hear about smallpox since the invention of vaccines against smallpox, and persons have been dying, and so therefore we need to now look at the brighter side and the more positive side and encourage one another. Persons who have been coming to get the vaccines and realize the importance of vaccination and what it can do to help them, to help their families, to help them. Because listen, if your child is sick, it takes money away from you. You're not able to go to work because you have to remain home with your children. You have to seek medical consultation, which incurs a cost. But if your child is vaccinated, you know your child is safe. You haven't got to worry. You can go to work. You can come back home. You can allow your child to go out and play with other children, because they are also protected.
And I guess I would say that I am one of those persons who are a bit resistant at times with vaccinations, but sometimes I sit down and I think about, if my child were to get, for instance, chicken pox, would I then vaccinate? So then, does it really make sense to put up a resistance in the beginning, only to have those necessary shots carried out at the end?
Well, Natasha, I have been at you in and out talking about this and trying to get you to have your child and children vaccinated, since you were very reluctant in the beginning, but gradually I'm very happy that I got through to you and you're now vaccinating the little girl. Thank you.
I should be a poster child by now, but no, on a real note, it is very serious, because right now we're seeing the re-emergence of measles. Some of these things, when I was a child, the issue was chicken pox, although I've never gotten chicken pox or anything like that. But we see even right now, close to us regionally and internationally, there are a lot of cases of chicken pox, and this was once thought to be an eradicated disease. So just reiterate that importance here in terms of the vaccine and preventing these vaccine preventable diseases.
In 2016, the Americas and the Caribbean were declared free of measles. However, we have lost the certification to that since the outbreaks in the Americas, UK, even as close as the Bahamas, closer to us now. And you know that we are a moving people. We travel to and from, and therefore if you are not vaccinated, means your immune system will attract the virus very easily, and you can transmit that infection, that disease, that virus to persons who have not been vaccinated, like yourself, and therefore we would have an outbreak. We don't want to have an outbreak in the BVI. Our last indigenous case of measles in the BVI was 1990. And we have seen the importance of the vaccines, the measles vaccines. We gave to the children 2 doses of the measles vaccine to have them fully immunized. Therefore, persons out there who have children and who are not vaccinated against the measles vaccine, we're asking them to please come in and have their children vaccinated. You can visit any of your health centers in close proximity to you and talk with the nurse and let them guide you to have your child or children vaccinated. Measles, the vaccine saves lives. The vaccine protects you and prevents the disease measles. Measles is one of the most contagious and deadly disease among children especially. Through the years, millions of people have died on account of measles disease. We don't want that to happen. So we need to protect our children. We're asking our community, and this is why our team says, do your part, protect your community, get vaccinated.
Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager, Natasha Letza.